Ebola funds won't help Congo until the disease spreads. This month, Ebola moved from the Democratic Republic of Congo, where it re-emerged in August 2018, into neighboring Uganda. The World Health Organization. Since 2017, the World Bank has been issuing pandemic bonds, which use private investment to help developing nations tackle outbreaks of infectious diseases. The particular bond, despite thousands of deaths in Congo, the bonds will only benefit affected nations once they jump international borders and a positive rate of growth of the outbreak is confirmed, according to a person familiar with the bonds. Then, and only that person familiar with the bonds also says, the criteria for the pandemic emergency financing insurance window to activate is, among others, that the outbreak is affecting at least 2 countries, with each country having surpassed a specific threshold of severity. A representative from the World Bank notes, "We are deeply concerned about the Ebola outbreak in DRC and the recent developments in Uganda. The situation is, in February, the Development Bank gave the DRC $80 million in grants to help finance responses for the Ebola outbreak. But the bank's ready, if the bonds mature without paying out, investors get their money back, plus the chunky coupons." Bodo Ilmers, head of policy at the European Network on Debt and Development, told the Financial Times in February that the financialization of risks is a new avenue for the privatization of profits and the socialization of losses. Such bonds are an example of a wider growing trend where private finance replaces traditional funding methods such as disaster relief aid. Catastrophe bonds.
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.